Have you ever taken your blood pressure at home and thought, that seems fine, only to still feel lightheaded, tired, or just not quite right? For many older adults, this quiet confusion is more common than you'd think. What if I told you that the way you're checking your blood pressure could be missing something vital, something that might help detect a stroke risk before it's too late? In today's video, we'll walk you through how to measure your blood pressure the right way, not just for numbers, but for real insight into your brain and heart health. If you're a senior over 60 or caring for one, this is information you can't afford to miss. Let's begin. Why blood pressure matters so much for stroke prevention. High blood pressure is the #1 cause of stroke, especially in seniors. Over time, high pressure weakens and damages the blood vessels in the brain. It can lead to clots, bleeding, or blockages, any of which can trigger a stroke, often with no warning at all. The scary part, many older adults have high blood pressure and don't know it, or they're measuring it in ways that give false reassurance. That's why accurate measurement is key. The danger of hidden high blood pressure. Doctors call it masked hypertension when blood pressure looks normal in the clinic, but is actually high at home. There's also white coat hypertension, where your pressure spikes in the doctor's office from nerves, but may not reflect your true day-to-day numbers. Both of these conditions are more common in people over 60, and they can make stroke risk harder to detect without home monitoring done correctly. The right way to measure your blood pressure at home, let's go step by step. This method is trusted by doctors and especially important for seniors. 1. Rest for 5 minutes before measuring. Sit in a quiet place. Don't talk. Don't move around. Let your heart settle. To sit in the right position. Back straight, feet flat on the floor, arms supported on a table at heart level. Don't cross your legs. Don't hold your breath. 3. Use a properly sized cuff. Cuffs that are too small or too large give false readings, something that happens often with older adults. If your arm is larger, ask your pharmacist for a large cuff. For take to readings, 1 minute apart. Write down both. If they're very different, take a third. 5. Check at different times of the day. Morning and evening are best. Blood pressure can spike early in the morning, a time when strokes are more likely. 6. Avoid caffeine, smoking, or exercise 30 minutes before. These can raise your numbers and give an inaccurate picture. What the numbers mean, especially for seniors. Here's how to understand your readings. Normal, less than 120/80ths. Elevated, 120 to 129 systolic and less than 80 diastolic. High stage 1, 130 to 139 systolic or 80 to 89 diastolic. High stage 2, 140/90ths or higher. If you're consistently above 130/80ths, especially in the mornings, your risk for stroke is significantly higher, even if you feel fine. For older adults, doctors sometimes allow slightly higher targets, but you must speak with your physician to know what's safe for you. Why accuracy matters more as we age. As we grow older, our arteries stiffen, and blood pressure can fluctuate more from moment to moment. Small measurement errors can lead to big decisions, like adjusting medications or missing signs of silent stroke risk. That's why the technique of measurement matters just as much as the numbers. This is not just about machines, it's about protecting your brain, your memory, your independence. When to be concerned: if you get a sudden reading over 180/120ths and you feel dizzy, confused, or have blurry vision, that could be a medical emergency. Also watch for pressure that spikes early in the morning. Many strokes happen between 6 and 11 a.m., and silent spikes often go unnoticed. If your numbers are consistently high, especially if you have diabetes, heart disease, or past mini-strokes, talk to your doctor right away. Don't wait until symptoms appear. With stroke, there may be no second chance. Keep a log, not just for you, but for your doctor. Doctors love patients who bring a notebook or printout of their blood pressure readings. Why? Because patterns tell a story. When the spikes happen, how often, and whether your meds are working. Even 1 week of well-tracked readings can help your doctor adjust your care and catch risks early. Final thoughts: 1 small habit, 1 big protection to every older adult listening today. Measuring your blood pressure might feel routine, even boring, but don't underestimate it. It's one of the simplest, most powerful ways to prevent stroke, preserve your memory, and keep your freedom. And it starts with doing it right. If this video was helpful, please share it with someone you care about, a friend, a spouse, a parent. And don't forget to subscribe for more calm, clear, senior-friendly health guidance. You deserve to age with strength, safety, and peace of mind. Until next time, take care of yourself. You're worth it.